Health officials continue issuing data regarding COVID-19, but are the rising numbers a real cause for panic? Joining us now to discuss COVID-19 data collection and stats is Reform California Chairman Carl DeMaio. Carl, good to see you. Good morning.
Good morning.
Okay, so let's talk about this data because it's interesting how it's interpreted, and of course it's being used for metrics as far as those triggers that are put forth by the governor. So you obviously have an issue with some of the data that's out there. Tell us what your problem is with the numbers being reported.
Well, first let's talk about what are we measuring. The county and the state of California are looking at 15 separate indicators. And they're using those indicators as triggers to shut down the economy, to infringe upon personal freedoms, and to make sweeping decisions at a time when the courts really have not been doing a lot to push back on those decisions and the intrusion into our daily lives. And so we have to ask two questions. Number one, are we measuring the right things? And number two, if we are measuring the right things, is the data accurate? Are we actually getting real, clean data that we can rely on? And the answer to both those questions is a resounding no. First, all of the decisions made in San Diego County to shut down portions of the economy again have been made based upon increased number of positive tests. Well, we knew we were going to have increased numbers of positive tests because we've doubled and tripled and quadrupled our testing capacity. And so by actual sample size, you're going to have increasing positive tests. You're also going to have increasing positives when you reopen the economy. The better metric to look at is COVID-19 a healthcare crisis? Are we seeing acute symptoms requiring hospitalization, intensive care units? Are we seeing an increase in deaths? And those metrics actually are the better metrics to manage by. And what you see there is that we don't have a crisis. Our healthcare system has kept pace. And in fact, we've seen an actual decline in hospitalizations. We've seen an increase in hospital capacity when you take a look at, say, June 10th, which was a very tranquil time relatively for COVID-19, versus the data reported on July 28th, just recently. We actually have less confirmed cases July 28th in the hospital than we had confirmed cases on June 10th, which is back again during the period of time when public health officials were saying, oh, it's fine to reopen. Looks like we were able to flatten the curve.
Okay, let me stop you there, Carl. Let me stop you there. Let me just stop you there and give you what would be the other side of the argument that perhaps because of the added restrictions and shutdowns, we then saw stabilization. And in looking at the percentage increase in cases, totally agree. The more you test, the more positive cases you're gonna have. Understandable. But in relative to what we were seeing earlier in this pandemic, they want to keep it at a certain point. So, away from that 7-8% we were seeing and back more towards the 4% we were seeing. What are your thoughts on trying to manage it and keep the numbers down, and perhaps maybe that's why we're seeing fewer cases now than we were before because of the added restrictions? Okay,
so let me try to deal with those two issues. Okay. First, most of the folks getting COVID-19 in this recent wave are asymptomatic. They're younger, they're healthier, they're not requiring acute care. Again, what we need to be worried about is our healthcare system going to be overwhelmed by acute cases of COVID-19? And the answer is no. We've actually improved our capacity since June 10th. We have more capacity in terms of hospital beds. We've gone up from 6,186 beds in San Diego County to 6,710 beds available in San Diego County during that same period. But what did the media say? Oh, suddenly there's this big surge. We have to shut down the economy. There's a big problem. No, as long as we can continue to show that we have the healthcare capacity to deal with acute symptoms, acute cases, that is the real battle. And that's the metric that we ought to be looking at. And that's what we ought to be managing to. Here's the other big scandal. On Sunday, San Diego County misreported its hospitalization numbers. And this was caught by local hospital executives who looked at the data and said, well, what you're telling the media is not reflective of our experience. Sharp, Scripps, private hospitals have all come out and confirmed to the media in the last 72 hours that they've seen declining or at the worst case, stable hospitalization numbers. Based on that disclosure, the county did admit that it got the numbers wrong. They reported 529 hospitalizations on Sunday, and then suddenly we found out that 71 of those were errors. They then revised it down to 458. The point I'm making is, if you're going to shut down the economy, if you're going to tell people they can't go to church on the basis of a measure, the measure better be right and your data better be good. And so we need to start asking tough questions of the county health officials. Is someone auditing your data? If there are mistakes, why were the mistakes made? And those answers need to be provided before we give them a fiat. We give them the pass to make sweeping decisions based on a few data points that apparently they've been getting wrong.
Those are all great points, great questions. So is your mission to open everything up, no safety protocols, nothing in place, or are you saying we should be opening up the businesses and the places where we can implement the tactics that we are thinking that work, the keeping distance, the masking, and the washing of hands?
Oh, no, my position has been the same from the beginning, that we need to understand the nature of COVID-19. We have to understand our adversary. And COVID-19 has been telling us what its nature is. We've got lots of data now that we didn't have back in March. What we have to focus on, what government needs to focus on, is a national surge on healthcare capacity. That means PPE, that means ventilators. And the president actually has been doing that. Can we do a better job? You bet. We always need more. But the focus ought to be on hospital capacity, not just positive tests coming back, because a lot of those positives are asymptomatic. A lot of those positives don't require healthcare acute care. And that means that we can weather the storm. We actually can monitor those individuals. They can do self-quarantine. It's not an either or, it's not an all or nothing. What we need to do is look for common sense ways to manage the risk of reopening the economy and allowing people personal freedoms, while at the same time very aggressively managing hospital healthcare capacity. Guess what? The County of San Diego is not doing that. That's not where they're focused. They're focused on breaking up birthday parties. They're focused on going and trying to stop churches from having assemblies on the beach in open air. That's absurd. I call on the County of San Diego to have your auditors look at your numbers and verify every day that your numbers are correct. I also call on the County of San Diego to start working with our healthcare capacity and healthcare executives to improve our capacity. Those are the numbers the media ought to be fixated on, because that's where the real battle would be if we do have a COVID-19 crisis flare up again.
Right. Carl DeMaio, thank you so much. Appreciate the time and the perspective this morning. Take care.